You're watching Cetome TV. Knowledge is power.
So I just want to briefly talk about some of the new combination therapies. And so Keynote 189. We started with Keynote 1. That was the first immunotherapy trial.
Wow.
And so Keynote 89 is just another one in the Keynote studies. Okay, there's many Keynote studies.
189 of them?
No, there's more than that.
Oh.
This is just Keynote 189.
Okay.
So this protocol has been around for a while. We started this a few years ago, and now we're happy to say that we're seeing a few patients in Canada that are getting it. It's not consistent across everyone. It's FDA approved, and it should be given to everyone right off the bat, first line. It's approved for first-line metastatic non-squamous and for patients that don't have EGFR or ALK mutations.
Okay.
Doesn't mean that it's not going to benefit those patients. It just means this is a limited approval, and this is one thing that really bothers me is these limited approvals. It's like a way of weeding out patients and saying, sorry, we don't want to take a chance on you.
But isn't that because of the lack of patient stratification you were talking about, right? They don't know how to tell for sure if it's going to work, and budget's tight, sadly, for healthcare.
So, great trial. We have a few patients on this right now. So it basically combines an old immunotherapy drug, literally the second immunotherapy drug ever designed, pembrolizumab. It was considered the second generation, and nivolumab was like the first, and pembrolizumab was the second. Pembrolizumab targets both the receptor and the ligand, the PD-1 receptor and the ligand. And so when you add that to standard chemotherapy, and the standard chemotherapy is pemetrexed and platinum-based, you can use cisplatin or carboplatin. We prefer carboplatin because carboplatin is easier on the kidneys, and slightly better protocol. Cisplatin may work a little better, but not much. It's like maybe 1 or 2%, and it has more side effects, and it can really damage your kidneys. So most doctors use carboplatin. Some will use cisplatin. So when you combine pembrolizumab and pemetrexed with a platinum drug, so the survival difference compared to standard chemotherapy is 22 months overall survival versus 10 months. Wow. This is metastatic patients.
Wow.
Then there's another study called the IM Power 131, and this is used as another third generation PD-1 inhibitor called atezolizumab. And they combine that with chemotherapy versus chemotherapy alone as a first line for stage 4 squamous. This is for squamous, not for adenocarcinoma. Okay. Keynote 189 protocol is only for non-squamous. Okay. And so this was actually for squamous. And the survival difference is 23.4 months overall survival average versus 10 for chemotherapy.
Okay, and these are for late stage?
They're for advanced first line.
Okay.
So that's the difference. So these are patients that are going to have a really poor response because they're stage 4 as soon as they're diagnosed. It's in all their organs, not all, but many organs. But it's their first treatment.
Okay.
And then there's a Checkmate 227, and that should give you an indication of how many Checkmate studies have been out there. Checkmate is for nivolumab, and this is also first line. And so in this one, they combined nivolumab, which is the first generation PD-1 inhibitor, with ipilimumab, which is a CTLA-4 inhibitor that we discussed last week. And that's another form of immunotherapy, ipilimumab. And so the overall survival, the average medium, was 17 months versus 13.9 for the chemo. However, when you look at the statistics, things panned out a little differently. So the overall was 23 months for nivolumab and ipilimumab combination versus 15 for nivolumab alone. And then the 2-year survival rate was 40% for the combination, the two drugs together, and 33 for, I believe it was the one drug. And then the progression-free survival was 23.2 months versus 6.2 months.
Wow.
For the chemotherapy.
Right. Wow. So adding in, was that for the combination, the nivolumab?
Yeah, so they did, the point was, what they wanted to do is they wanted to compare single agent to adding this CTLA-4 inhibitor.
Got it.
So they compared the two together.
Right. And it gave people a lot more time.
Big difference by adding ipilimumab, yes. So now we know, add ipilimumab with your PD-1 inhibitor.
Wow.
And so that's about it. I could go on and on and on, but yeah, I just wanted to cover our new faves. So those are our new 3 faves: the Keynote 189 protocol, the IM Power 131, and the Checkmate 227.
Okay, good.
Those are the ones we would be suggesting right now.
What's important, if you're watching this video at any point, even a month down the road from now, while this information will still be true, there's almost certainly going to be some new information
there's so
as
much.
well.
And just today, there's so much information. You know, there's a lot of people making PD-1 inhibitors now.
So this is really inspiring. If you have lung cancer, there's so much that you can do. People, they're depending on the genetics, the molecular drivers of your cancer. There's, I mean, I'm still floored by that one study you were talking about.
With the KRAS inhibitor.
With the, like 100%. Wow. Wow, I'm just really...
That's the disease control rate. So the disease control rate is all 3 responses together.
Right.
It's...
56%
had
an
high.
Outrageously amazing response if they had that one genetic target.
So just to be clear, the disease control rate includes a complete response, a partial response, and a stable disease, because they're 3 different responders.
I understand. Okay, but I'm still excited.
Yes,
you can't stop me from
too.
being excited.
No,
There's some really, from a cancer that used to be really, exceptionally deadly and scary. This is really exciting for people, especially what you were talking about earlier about some folks who were, very late stage, had already tried 3 or 4 different types of treatment. Just adding certain things, modifying certain things, and knowing what genes are driving your cancer has given them years more life.
Exactly. Yes.
Thank you for watching Ketome TV. Subscribe below and stay informed.